Today's topic is chickenpox. A disease commonly of children is caused by varicella zoster virus. Varicella zoster virus, also known as human alpha herpes virus 3, belongs to the herpes virus family. The envelope is interspersed by spikes made up of viral glycoproteins. The varicella zoster virus genome is double-stranded DNA coiled upon a protein axis and characterized by rash, fever, headache, and cough. People who get the virus often develop a rash or spot that looks like blister all over their bodies. The blisters are small and sit on an area of red skin that can be anywhere, and they are of various size. It's very rare to have the chickenpox infection more than once. And since the chickenpox vaccine was introduced in the mid 1990s, cases have declined. Causes: varicella disaster virus causes the chickenpox infection. Most cases occur through contact with an infected person. The virus is contagious to those around you for 1 to 2 days before your blisters appear. Varicella zoster virus contagious until all blisters have crusted over. The virus can spread through saliva, coughing, and sneezing. Pregnant woman to the body, direct contact with infected person, by airborne respiratory droplets, by skin to skin contact, by touching a contaminated surface. A person with chickenpox became contagious 1 to 2 days before they appear and last until all the blisters have crusted over. Contact with fluid from the blisters. Signs and symptoms. The hallmark symptom of chickenpox is a rash. Before the rash appears, there will be a general feeling of being unwell, fever, which is usually worse in adults than children, aching muscles, loss of appetite, in some cases, a feeling of nausea. After the rash appears, there will be rash. Severity varies from a few spots to a rash that covers the whole body. Spots. The spots develop in clusters and generally appear on face, limbs, chest, stomach, and they tend to be small, red, and itchy. Cold, fever, fatigue, sore throat. Fever may be high for first few days. Headache, general feelings for illness, and abdominal pain. Complications. Chickenpox is normally a mild disease, but it can be serious and can lead to complications including dehydration, pneumonia, inflammation of the brain, toxic shock syndrome, and death. Prevention. No specific treatment for chickenpox. The usual control measures are notifications, isolation of cases, and disinfection of articles. Rubella vaccine. Most healthy children and adults only need home treatment. Soak in oatmeal bath to help with itching. Chickenpox or varicella vaccine protects 70% to 90% of those people who are vaccinated. Varicella vaccine contains live virus and so is not recommended to children having compromised immune system or severe illness. The vaccine should not be given to children who are allergic to neomycin or gelatin. This vaccine is given to adults, which also prevents shingles. Side effect of vaccine is redness or soreness at the site of injection. Most risk from chickenpox: infants, adolescents, adults, pregnant women, and people with bodies that have a lowered ability to fight germs and sickness because of illness or medications. For example, people with HIV or AIDS or cancer. Chickenpox during pregnancy may result congenital varicella syndrome, severe varicella syndrome, and risk of neonatal death. Treatment. Apply cold compress to blisters. Cool water bath with adding baking soda to avoid itching. Acyclovir is the only food and drug administration approved treatment for chickenpox. Treat fever with acetaminophen. If the skin is sore and aggravated, dress appropriately so they don't get too hot or too cold. Loose fitting, smooth cotton fabrics and will help stop the skin from becoming sore and irritated. Medicines. Treating chickenpox with folk medicines are aloe vera, ginger, garlic, and lemon.